Hello, I am Madison Lingle, and Tony, Margaret, Casey, and I were chosen to do the Certified Registered Nurse Anesthetist, or a CRNA, presentation. On the first slide, we talk about the CRNA's role. We found that they provide safe, high-quality, patient-centered care. They reassure and comfort patients before, during, and after medical procedures. They bring anesthesia services to practice settings that would otherwise be lacking them. They make healthcare cost more effective. If you were to compare CRNAs to other roles, this is what you would see. Registered nurses provide and coordinate patient care and educate patients and the public about various health conditions. They work in a variety of facilities, including hospitals, physicians' offices, home health care services, nursing care facilities, outpatient clinics, and schools. Another area in healthcare is nurse practitioners. A nurse practitioner is a registered nurse who has advanced education and clinical training in a healthcare specialty. They serve as primary healthcare providers for children and adults during health and illness. Another example of a healthcare member is a nurse administrator. They supervise nurses and other healthcare team members. They recruit, hire, and train nurses. Other responsibilities include building work scheduled and conducting performance reviews. Some requirements to being a CRNA are as listed below. 1. On average, it takes 7 to 8.5 years of education. It takes a BSN or graduate degree in nursing or another major. They also have to have an RN license and or an APRN license in the United States, a minimum of 1 year working full-time in a critical care setting. That can include an ICU, ER, or life flight. They also need a master's degree from a nurse anesthesia educational program accredited by the Council of Accreditation of Nurse Anesthesia Education Programs, called the COA. CRNAs are able to work in many different areas, for example, hospitals, doctors' offices, surgical clinics, in the military, psychiatric institutions, respiratory therapy departments, emergency rooms, and outpatient care centers. The different specialties CRNAs work in is general surgery, trauma, obstetrics, cardiac, orthopedic, dental, gastrointestinal, and plastic surgery. Here's a list of their scope of practice. It is determined differently per state. They're independent in the state of Iowa, which means they do not have to have an anesthesiologist oversee them. It also just depends on what facility they're working at as well. They do assessment of health statuses. They obtain a relevant health and medical history. They perform physical examinations. They order preventative and diagnostic procedures based on the patient's age and history. They formulate differential diagnoses. They develop treatment plans, educational plans. They receive third-party reimbursement. They maintain hospital privileges, and they promote health maintenance. Some educational statistics. Nurse anesthesia programs range from 24 to 51 months depending on the university requirements. An average of 9,369 hours of clinical experience are conducted per person, and there are 130 total CRNA programs in the United States. Rules, issues, and challenges. Some challenges is the scope of practice debate, especially depending on which state you are in. Staffing shortages, especially with burnout, increased demand, increased responsibilities, reimbursement, education, and training. States here, in 31 states, there is no supervision required for CRNAs in state nursing laws/rules, hospital laws and rules, or ambulatory surgery centers laws and rules. In 43 states, the nursing laws and rules do not require physician supervision of CRNAs. This slide talks about the CRNA competencies, like intubation and advanced airway management, ventilator management and troubleshooting, dosing and administration of sedation medications, management of paralytic drips, central, peripheral, and arterial line insertion, vasopressor selection and management, intravenous fluid and blood administration, and lastly, ventilator weaning, extubation, and post-extubation evaluation and care. CRNA standards of care. They perform and document a pre-anesthesia assessment and evaluation. This includes many different questions that they are asking the patient and the patient's family. They obtain and document informed consent for the planned anesthetic interventions from the patient or legal guardian, or verify that informed consent has been obtained and documented by a qualified professional. They formulate a patient-specific plan for anesthesia care. Lastly, they implement and adjust the anesthesia care based on the patient's psychological status. Continuously assess the patient's response to the anesthetic, surgical intervention, or procedure, and they intervene as required to maintain the patient in an optimal physiologic condition. More standards of care. They monitor, evaluate, and document the patient's psychologic condition as appropriate for the type of anesthesia and specific patient's needs. When any psychological monitoring device is used, variable pitch and threshold alarm shall be turned on and audible. The CRNA should attend to the patient continuously until the responsibility of care has been accepted by another anesthesia professional. They document pertinent anesthesia-related information on the patient's medical record in an accurate, complete, legible, and timely manner. They also evaluate the patient's status and determine when it is safe to transfer the responsibility of care. Accurately report the patient's condition, including all essential information, and transfer the responsibility of care to another qualified healthcare professional in a manner that assures continuity of care and patient safety. Lastly, they adhere to appropriate safety precautions as established within the practice setting to minimize the risk of fire, explosion, electrical shock, and equipment malfunction. They verify that infection control policies and procedures for personnel and equipment exist within the practice setting. They participate in the ongoing review and evaluation of anesthesia care to assess quality and appropriate list. And lastly, they respect and maintain the basic rights of patients.